what would be the telltales really? I mean, if just the top telltales of AI.
Of autoimmune disease?
Yes, please.
Well, it can look like anything. This is the problem. I mean, for example, hypothyroidism, which is an enormously growing disease, problem, it can look like just about any disease that's out there. And so this is where the problem comes, that I think it's very often under-recognised, because you can have an animal that keeps coming in, for example, with repeat infections. And you think, oh, well, you know, that is a problem with this animal's immune system, and that's all it is. And so we keep giving antibiotics. Or it comes in, you know, with ears, that just repeated ear infections. Now, many of the profession know that that can be allergy, but that could also be that what's actually underneath there is autoimmune thyroid disease. And it's missed many, many times. I get a lot of referral cases, and if you just do the diagnostics, for example, and test thyroid alone, you'll pick up an enormous number of what is actually autoimmune disease. Because they cover such a huge spectrum, it can look as if it's fine. You might have something on the skin that breaks out, you might have something like low-grade thyroid disease, and although the animal's not 100% healthy, it can look as if everything's okay for a long, long time. But these diseases are progressive, and eventually they can turn into either cancer, because there is a relationship as well with autoimmune disease and cancer. Cancers, by the way, as well, can also trigger autoimmune disease in themselves. But later, these animals can get worse types of autoimmune disease. For example, the nasty diseases like immune-mediated hemolytic anemia and thrombocytopenia, which are life-threatening emergencies. And then, of course, pet owners can lose their animals because, again, unfortunately, in the conventional world, therapeutics for these are massive doses of immunosuppressant drugs in the same way as it is in cancer. And there is no targeted therapy conventionally for autoimmune disease. It's all very heavy immunosuppressant therapy. And it doesn't target a certain autoantigen at this point in time. It's just blunderbuss treatment.
In terms of homeopathy, have you found out that there might be some certain homeopathic remedies that more often pop up in these cases than not?
Yeah, we have to be very careful of that, because good homeopathy is about individualising prescriptions, and some of these cases for the homeopaths out there are very syphilitic. They recognise that term. It's a miasm term of the way the body responds. And some of them are not. Some of them are what we would class as the soric miasm. And so again, there's a spectrum of remedies, and it's very much individualised. And many of the cases that come to homeopaths are completely suppressed, already coming to the homeopath on massive doses of steroid, or azathioprine, or cyclosporin. So they're on immune suppressant therapies. And so they've got to dig these patients out and try and counter the therapy that they're already on in order to get individualised prescriptions in. But families like the venoms, the snakes, the animal remedies, the syphilitic remedies are much more commonly used, alongside remedies to try to help the animal get over the actual therapy it's already been on.
You were saying that some animals are more susceptible to getting autoimmune diseases. What would be the manner of treating these animals from the viewpoint of the owner, so as to hinder the animal to get these diseases to begin with?
Yes, it's about avoidance of triggers, because, as I say, in autoimmune disease we know there is a susceptibility and a trigger required to push that animal over into autoimmune disease. Stress, unfortunately, is one of the biggest triggers, so is avoiding stress points in the animal's life as much as any of us ever can. Minimalising vaccination and only vaccinating if you have to, at the times in life when that animal is not under stress and when the animal has not got the block of maternal immunity in there. So not doing these, vaccinating these animals at 6 weeks of age or 4 weeks of age or silly early vaccination. It's vaccinating when the immune system is most able to cope with it, not unnecessarily repeating booster vaccinations, perhaps considering teeter testing them rather than actually giving boosters automatically, making sure that the food is chemical free, grain free, minimising chemicals in their environment, minimising the number of drugs they're given throughout their lifetimes, not putting lawn dressings on the lawn, not having plug-in aerosols in the house. There are all these little steps that you can make to try to minimise the risk of your animal going into autoimmunity.